Hi, everyone. It is Let's Talk Tuesday. Blah, I can't talk today. Let's Talk Sex Tuesday for Tuesday, October 22nd. I'm in my living room because I just didn't feel like going to my studio today. That happens sometimes. And today, just going to turn my phone off. We are talking all about HIV and AIDS. And the reason we are talking about HIV and AIDS is because it is AIDS Awareness Month in October. So as a sex educator, I like to talk about a mix of things here on the Happy Vagina Project channel to empower you to have safe, awesome, pleasurable sex, and also to teach your kids how to do the same, as well as to bust through stereotypes, shame, and negativity that we have around all kinds of different sexualities. So it may be that you have not felt that the AIDS conversation has been relevant to you or your personal life since it became a massive thing in the 1980s. But so much has changed in the last 30 years. So much has changed about this virus and this syndrome and how it works. And it is important to know these things to be able to talk to our kids about it, or at least, be in the know about where to get resources. It's important in case we have single friends who are still in the dating game. It's important should we ever end up single again ourselves, or if we're in a partnership where sex with more than one partner is happening. Also, I think really the most important reason that I want to bring this up today is that there's still a lot of harmful and negative stereotyping out there around HIV and AIDS, and we want to nip that in the bud and just change the conversation around STIs in general and HIV/AIDS in particular. So today you can consider this kind of like a mini high school flashback lesson, although hopefully it will be much more pleasurable than a high school sex ed lesson. And I just want to go over kind of what's happening with HIV/AIDS these days and what you need to know, in particular if you've got teens who are starting to enter their sexual years. So that's what we are here to talk about today. Let me know in the comments if you have any questions about this stuff. I can send you resources. I might be able to answer questions myself, and we will get going. And I've just got some notes today because I want to get this right. So if I'm reading, that's just because I want to get this right because it's an important topic. Okay, so HIV and AIDS, right? I want to invite us to kind of think about sort of what comes to mind when you think of HIV and AIDS. And for me, it's a Degrassi Junior High episode. In particular, where the one guy, I forget his name, finds out he has HIV, needs to tell a bunch of people, it's a death sentence, it's a big deal, he's freaking out. And that was kind of the context that I grew up in, right? So I'm turning 35 this year, and AIDS and HIV was this very serious, very big deal, very big death sentence, STI that you could get. And that was the context in which it was taught. It has killed many, many millions of people, in particular in certain communities. And we know that still to this day, approximately 33 million people worldwide are HIV positive. So it still is being spread. It still is relevant in many people's lives and not necessarily in the lives that you think. So we still have this idea that HIV/AIDS is only lives in the homosexual community. This is not true. Anyone can get HIV/AIDS. Anyone can contract it. Anyone can transmit it. And actually, a lot of new cases are being passed around by teens and young people, right? So things have changed a lot since the 1980s. AIDS and HIV are no longer a death sentence. They are manageable with medications. You can actually, we can't cure it and we can't vaccinate against it, but with certain medications, we can almost make the virus disappear from your body. And I'll talk about that a little bit more as we go through. So I just want to start with a little bit of a kind of a definition and remind you kind of how HIV/AIDS works in the body. Then we'll talk about how it's transmitted and passed around, what you can do about it, and what you need to know. Kind of like HIV/AIDS 101 today, all right? And I'm going to try to keep it as short and sweet as possible. So some quick definitions. What does HIV even stand for? It stands for human immunodeficiency virus. And when we contract this virus, it affects our immune system. And if it gets out of control and completely takes over our immune system and we become compromised, then we may be diagnosed with AIDS, which is acquired immunodeficiency syndrome. And that basically means if we have HIV, we don't necessarily have AIDS. Basically, we develop AIDS if our HIV is not treated and gets to the point where our immune system is completely taken over and we are very susceptible to other diseases and infections. How it works is HIV is a virus. It finds a way to enter your bloodstream and it attaches to a very particular kind of white blood cell called a CD4 cell. And CD4 cells are like the quarterback of the immune system, and they head out and venture into the body, and then they head back to immune system central. So what happens is wherever this CD4 cell is in the body, when it encounters HIV, the HIV hijacks it, takes it over, starts to reproduce, hitches a ride back to immune system central where it can come into contact with many other CD4 cells, and then it starts to replicate, duplicate, and take over the immune system. So like I said, you don't get an AIDS diagnosis right away. This would only happen if the HIV were to progress to a point where you received an AIDS diagnosis. You may have the virus for years with no symptoms or awareness, which is why it's important to get tested. We'll talk about that a little bit later. And most people, or basically like a person doesn't die of HIV/AIDS. Essentially what happens is their immune system is compromised to the point where they may die from other diseases, infections, and cancers, right? So this is a virus which affects your immune system and makes you susceptible to other things and puts you in a position where your body can't fight, okay? So what do we need to know? One of the most important things we need to know is how it's contracted and how it's spread. There's still some myths out there, so we'll try to clear those up today. So the main thing is this virus is looking for a way into your bloodstream, and it can access your bloodstream in a couple of ways. So the first is directly blood-to-blood contact. So that might happen if we're using an infected needle. So if we share a needle for intravenous drug use and one person has infected blood and that blood goes straight into my blood, then we've got blood-to-blood contact and the HIV can be transmitted. If I'm using an infected tattoo needle that has not been cleaned, it's been used on one person and then another, again, that's direct access to the bloodstream. In the past, HIV has been passed on through blood transfusions. The risk of this is almost negligible now, but that is a blood-to-blood contact situation. The second situation or second context in which it passes on is that there are certain fluids in the body that HIV can be passed through. And in particular, they are fluids that are near delicate mucous membranes in the body. They can be easily torn or develop small fissures, which again provides direct access to the bloodstream. So semen and preseminal fluids or pre-cum can hold the HIV virus. Fluids in the rectum, fluids in the vagina, and breast milk can all contain HIV. So sexual intercourse, whether it's vaginal or anal, can basically result in semen or fluids with HIV coming into contact with a small fissure and entering the bloodstream. Also, childbirth can result in transmission of HIV/AIDS from mother to child, and breastfeeding can also result in this. So the main thing to remember or to keep in mind is this is about access to the bloodstream. And basically that happens with needles in any context and with sex. And that includes vaginal and anal penetration or intercourse. And we'll talk about how we can keep ourselves safe in a minute. But this is how HIV is transmitted. HIV is not transmitted through saliva. You can kiss someone with HIV/AIDS and you will not get HIV/AIDS. It is not transmitted through touch, through hugs, through any other kind of part of the body. So we're really talking about sexual acts and through blood-to-blood connection or transmission, okay? In terms of, protection, what do we do about this virus? It's pretty much the same as any other sexually transmitted infection. And I just want to add a little note here. So, if you grew up in the 80s and even still to this day, we do a lot of shame and blame around sexually transmitted infection education. We throw up pictures of nasty, nasty things, and we basically say sex is bad, sex will give you these diseases, so don't do it. And we're really trying hard as sex educators to reframe the conversation around this. To basically say, when I go around the world, there are many different viruses that I can come into contact with. And I do my best to protect myself by staying in good health, maintaining my immune system, washing my hands regularly, using sanitation products, as needed, cleaning my environment, etc., etc. And this is how I protect myself from getting the cold, the flu, strep, hepatitis, any kind of virus or infection, bacterial infection that's out there in the world. Now, despite my best efforts, even if I am the, cleanest, most healthiest person on the planet, these diseases, these bacterial infections, these viral infections do not discriminate, and they will find their opportunities. That does not make me a bad person. That does not make me a gross person or a dirty person. Sexually transmitted infections are exactly the same thing. When we touch our genitals together, there are certain bacterial infections and viral infections that really love those environments. They love our mouths, they love our anuses and our genitals, our vaginas and our penises. And even if somebody is practicing safe sex, getting tested regularly, these are things we can do to protect ourselves and stay healthy. These colds and flus of the genitals do not discriminate either, and anyone can get them regardless of how much effort they're putting in. If we get an STI, it does not make us dirty, it does not make us bad, it does not make it gross, okay? They can happen to anyone. So many of us are walking around with different STIs. HPV, which is genital warts or warts, and herpes are extremely common. Like 80% of the population has some form of this virus in their body. They just may not be reacting to it. So we need to stop the shame and blame around STIs and understand that getting tested and taking charge of our sexual health is how we prevent the spread of these infections and keep everyone healthy. So when we get tested, we're taking charge. If we get an STI of any kind, like half of them are treatable, easy peasy, few drugs, no problem. The other half are completely treatable and manageable, either with medications or diet or other things. So it's not the end of the world anymore. In particular with HIV/AIDS, it is not a death sentence anymore. And that doesn't mean I'm going to walk into the sexual world like begging for an STI or asking for it. I don't want a cold, I don't want a flu, I don't want to have to take penicillin or Tylenol or drugs. But if it happens to me, I'm going to take care of myself, I'm going to get the medications that I need, and I'm going to let the people that need to know so that they can do the same. That is my side rant on STIs before we get going. So in terms of protection for HIV/AIDS, just like every other STI, the only protection that there is abstinence or condoms. You can use internal condoms, which are called female condoms. They go inside the woman, inside the vagina, or you can use male or external condoms that go on the penis. These provide a skin barrier so that the fluids do not come into contact with each other. So vaginal and penis fluids or semen cannot come into contact, and semen and rectal fluids cannot come into contact, as well as the semen or those fluids cannot come into contact with fissures either inside the vagina or inside the anus or rectum. Vaginas and bums are more susceptible to these kinds of infections because they are internal, moist, warm spaces with sensitive tissue that can tear. Penises are a little bit less sensitive to these things. There's a little bit less opportunity for infection there. So that's just something about the way our anatomy is built. So condoms are the only tool you can use to protect yourself against STIs. Your birth control pill, your diaphragm, your IUD, your spermicides are not sexually transmitted infection protection, okay? Obviously, or in addition, we need to consider blood-to-blood contact, right? So that means using clean, sterilized needles if we are doing injection drug use, finding safe injection sites, making sure we're going to reputable tattoo parlors where we know the needles are sterilized and not used on the same clients. And if we're working in healthcare, making sure that we're using gloves and taking different kinds of protection. Now with HIV/AIDS, there is actually a new kind of medication called PrEP, or pre-exposure prophylaxis, that someone can take if they're in a higher risk environment. So if they're an injection drug user who doesn't always have access to safe needles, if you work in the medical profession that's particularly high risk, if you have a partner who's HIV positive and you want to be protected, you can take PrEP. And I would have to do more research on exactly how it works, but essentially it minimizes your risk of infection even if you do come into contact with the virus. So this has been a game changer for many populations in terms of suppressing the spread of HIV and AIDS. So that's how we protect ourselves. In terms of what else we want to do, testing is absolutely critical. And one of the things that's important to know is, so if we do contract HIV, there are now drug cocktails. So we take a combination of pills that together can manage this virus. And they can actually reduce the number of infected cells in your body, so much so that when you get tested again for HIV, it shows that you are not infected. So some people who have been diagnosed with HIV and are taking their medications on a regular basis have undetectable HIV, and it's actually safe for them to be having sex. They cannot transmit HIV through sex when their viral load, we call it, when their levels of HIV are undetectable. What that means is it is better, it is safer to be someone who has gotten tested, know they have HIV, take their medications. It is safer to be a person who is HIV positive and taking their medications to have sex than it is to be a person who has not been tested and has no idea and is having sex. So when we get tested, we keep ourselves safe, we keep other people safe and healthy. And like I said, a positive diagnosis says nothing about your character. It says nothing about your personality. It says nothing about who you are in the world. We have to get rid of that shame and stigma. It just means you're a person who contracted this virus. And it's not a death sentence. There's lots of ways to treat it. It doesn't mean we're going out to go get HIV, to contract HIV, but that it is treatable and manageable if we do contract it. To get tested, you need to get a blood test. There's now rapid testing available at many sites across Canada and the States, or you can go see your doctor or go to an STI clinic and have your blood tested. So it's a relatively simple process depending on where you live, and rapid testing has really changed things because it's I believe it's a quick pinprick and they can tell almost immediately right where you are. The blood doesn't need to get sent to a lab or anything. So those are my notes today about HIV and AIDS. If you have any questions, definitely let me know. You can always private message me or send me an email if you want to know more. And I always send people to Planned Parenthood for these kinds of resources. Just Google Planned Parenthood HIV/AIDS. They will walk you through testing options, more about PrEP, more about treatment cocktails. And there's also many sort of AIDS associations in Canada and America that can help you if you are HIV positive or if you have AIDS. Yeah, that's my last word of the day. It's important to know about these things. It's important to know about these things to take care of our sexual health. STIs are part of the deal. We want to make sure that we are safe and keeping others safe. And that's how she goes. That's all she wrote. Happy AIDS Awareness Month. This is a great month to learn more about HIV and AIDS, to learn more about the people in your community who are living with this virus and this syndrome, and to examine and question and challenge some of the beliefs that you might have around STIs, the spread of them, and what it means about a person if they have one. Thanks so much for tuning in. I will catch you next week. Bye.